All right, I'm super excited to talk about this topic. The Summit team asked me to present on a bill that we recently passed for physical therapists to become primary care providers in Utah. And some people kind of freak out about this bill, and some people are like really excited about this bill. But we are going to play a little trivia to talk about this bill and what it means and how it's going to help every single person in this room. So is what we're going to do. You see there's these little trivia buzzers at the four corners of the table. We're going to separate in four quarters of the room. And your role is to make sure you have each one of these roles within your quarter of the room. So you have an MD, PA or MP, PT or OT, someone in admin or marketing, massage therapist maybe if we have enough in the room, and then anything else. Is there any others that I missed? Chiropractic. Why did I not put that on there? I'm so sorry. That is not intentional, I promise. Yeah. Talk to you after that. Okay, so make sure you have someone in your group. So go ahead and divide. And while you're dividing, just make sure, talk around to your group and make sure you have someone in each one of those areas. I'm just playing this for background music. Do we have audio? Talk to your group. Make sure you have a PT. Remember, and just so you know, there is $50 on the line. So you got 2 minutes. Get in. Come on in. We need you, Lindsay. Okay, are we ready? Everyone's got your team ready? Okay, so I got this background music playing. I want you to listen to this song while I'm talking. But this $50 is going to go to the person who has the most energy today. And we got this committee, Amy and Lauren. They're going to select the person that gets this, okay? So I'm playing this song because, you know, in healthcare we have so many complexities. We have so many problems that we need to solve, right? And it's a beautiful day to be in healthcare. You know, I have this logo up here, the Healthcare Revolution. This is a podcast that we started, and it's all about connecting the healthcare team and working together in collaboration. Similar as Many Minds. It's this Many Minds approach, coming together as a team. And I have seen this team come together in my short career more than I think ever has happened in the history of healthcare. Everyone's coming together finally. My profession is coming together collectively as a whole state and even as a nation. And we're seeing healthcare workers work together as a team more than ever. And I remember in school, sometime in like 2035, if I remember right, based on feasibility studies, Medicare patients will exceed the number of healthcare workers. And that's just a wild stat for me. I just can't even comprehend that. And if we get to that point and we are not working together as a team, this will not work. Healthcare will no longer function. There will literally be more people to serve than there are healthcare workers. And that's a huge need. We're going to talk about these needs in Utah and how they're going to influence us. So our first, this was a Lamborghini I got to drive. This is not my Lamborghini, by the way, just for the record. But we had won an award, and a patient let me use this car for the night. And I was driving this car, and I thought to myself, who is driving the patient's car? Who are they letting in the front seat? Like, who are they actually giving the wheel as a provider? And I thought to myself, no one actually should be in the driver's seat besides the patient. You know, everyone else should be in some sort of passenger role. And it's every one of us, you know, there's this kind of like turf that we fight over in being that primary role in a patient's life. But ultimately, who is in the driver's seat? It should be the patient. The patient should be driving at all times, and we should help them navigate and give them options and work together as a team to collectively speak together. So think about that as we talk about this primary bill. So this is the first question, and let me go over some rules. So you have to, you can use any resource for these questions. You can use ChatGPT, you can use your therapist, you can use your MDs, whatever knowledge you have. I anticipate that someone in your group knows the answer to these questions, but you have to do one of these 4 things to be able to, before you hit your buzzer. That means you either have to do 5 squats, 5 lunges, 5 push-ups, or run in place for 5 seconds. Got it? So you have the answer, got to do one of those 4 things, and you at least have to do one of those 4 things once. Brandy's ready. And it would be preferred that someone else does it in your group every time. Not required, but preferred. Okay? So this is the first question. Everyone ready? Where is Utah ranked in the nation when it comes to access to primary care providers? Go. First person to hit the buzzer wins. You gotta hit the buzzer. Hit your buzzer. All right, team, we're just gonna call it team 2. 10 seconds. 10 seconds. Nope. Second person. Go for it.
40 seconds.
40 seconds. Nope. Yeah. Whoever gets it first. That's you got it first. We're the worst? That's true. So according to the U.S. Department of Health and Human Services Agency, Utah currently ranks the worst in the entire nation. We are literally dead last when it comes to access to primary care. Who's surprised by that? Why? Why is this a thing? Why do you think? This is a big group that told us this.
Population growth.
So we're actually, we're ranked the third in the nation for growth, but yet we're the worst. Ty, go ahead.
Second.
We're second. Did I get that wrong? Second in the nation.
Second only to Idaho.
Okay, go ahead.
Is it because we export our care to other schools?
Maybe.
So we don't get
I'm not sure of the answer.
staff?
So I'm curious, like, what your thoughts are. Go ahead.
This is just anecdotal, but I've been with the same Spanish work primary care practice. I've been through like 5 physicians in 6 years.
To turnover, maybe?
Turnover. Like, oh, that guy left. And
It's a hard.
Oh, that guy left. Now there's a new guy. Like, every time I'm going in and meeting somebody new.
Yeah, go ahead.
Primary care is actually one of the hardest to have providers go into. It doesn't make, as far as like money goes, it doesn't make as much money as a specialty does.
Yeah.
And it's, to be honest, as a primary care provider, it's a really taxing job. You're in charge of a lot of different things. You don't just have to focus on one specialty. You have to focus on everything.
You got to know everything, essentially.
Yeah. And so I know that coming out when I was looking for jobs, like there were primary care jobs everywhere. The specialty jobs there wasn't.
Does anyone work primary care in private practice?
I do some private practice as well.
Okay. So another thing that we should think about is I was talking to a primary care practice owner yesterday, and they said like, oh, we can get patients in within 2 weeks. But then you call up to a big system, whether it be Intermountain, University of Utah, it can take up to 6 months, right? So a lot of people just don't understand how to get access to care. That these big systems are overwhelmed, but primary or private practices are in obscurity. They can get them in faster.
But you also have to go with the insurance too, right? So that plays a big role in whether or not who that patient can actually see.
For sure.
In order to get the care that they need.
Yeah, if a patient has Select Health insurance and Select Health doesn't credential with private practice, then they can't see Select Health patients. Yeah, access to care for sure.
Utah has one of the lowest reimbursement rates, doesn't it? So you add
does.
primary care already being a lower reimbursement to that's going to be a hard specialty for people to want to practice.
In primary care, you really have to know all specialties. You got to have relationships with everyone. You got to know who to refer out to and when, right? And then you have all these different providers you're referring out to, and then you have providers maybe talking poorly about your decision. Like Pete spoke at the last conference, talked about that, how it's a burnout level for him because different providers say, oh, this wasn't appropriate to refer to me. when he's just trying to do his job, right? But ultimately, primary care is a really hard role. So this is a huge problem that we have in Utah. Okay, next question. Oh wait, crisis. Rising physician shortages are overflowing patients into emergency room. Where do patients go if they don't have a primary care? Ask your patients as they come into your clinics, do you have a primary care provider? A lot of people don't. Like, just do your own kind of analysis on this. So access to traditional PTs is declining and worsening. Patients are waiting too long for help. And then PTs can step in. The opioid crisis is on the rise. 80,000 deaths in 2023, right? People just want a quick fix, but they just don't know where to get it. So they're going to all these different sources to find it. Question number 2. What is direct access for physical therapy in Utah? And what year was it implemented? I'm going to get you on the year. Let's go. 10 seconds.
Direct access probably
Hit the buzzer. Hit it. Hit it. All right, team 3, go. Team 4 is on the dot. Did you? Oh, you guys. Actually, team 4 did the exercise before you. Before you. 1985. You got it. So what is direct access without looking at it?
The 1900s. Come on.
So Lauren's going to explain it, what direct access is.
Direct access just means that patients don't need a referral to come into PT, and they always think that they do, even though they don't.
Did everyone, so there's a caveat to that, based on Medicare rules. Based on Medicare rule, you actually have to have a referral. We'll talk about that in a minute. But the majority of commercial insurances, there's some caveats, but the majority can be seen by a physical therapist without a referral. Did everyone know that? This is back in 1985 that this happened. So society doesn't even know that they can go to a PT without a referral in the first place, right? In our recent efforts focusing on recognizing physical therapy as a primary care option, really it's just an entry point. That's why it's primary care, because we've been an entry point since 1985. But PTs need to understand that means as you are an entry point, that means you are a primary role, because that means you need to refer out if appropriate. But the idea is PT for injury, MD for illness. Like, we're assisting in that care because we're musculoskeletal experts. We are not illness experts. We have to know when to refer to those certain providers. Next question. What percentage of senators and legislators supported the PT primary care bill earlier this year? Oh, if we don't get this quick, I don't know. Ty, help out. Group 2. Literally Ty knows all these answers. Get him to work.
Hey, we got 100%.
Okay, 100%. That's true. 100%. This went unanimous across the House and the Senate. Why? Why would senators and legislators would support this 100%? You know the only person, the only group that pushed back on this? Who do you think it was? Primary care. Yeah, it was the Utah Medical Association. The CEO, it's not to bash on her, she literally said, I will do everything in my power to stop this bill because private PTs don't do 2 things. They don't prevent and they don't diagnose. PTs in the room, how do you feel about that? What do you do as a PT? Do you prevent? Right? I hope a lot of the medical team can see that prevention is literally all we do. And there was some context she didn't really understand that we explained to her, but it passed unanimously. There's huge support for this. But it's understanding what this bill means and how it can help society as a whole. Okay, next one. PTs are now able to prescribe medication and diagnose disease. True or false? Exercise, go. Absolutely not. Doesn't change scope of practice for PTs. We did not open the scope of practice for physical therapy. It does not change our scope. We do not diagnose disease. We do not prescribe medication, nor do we want to. All right, next question. What did this bill do for the specialty designations for PT, and how will it increase access? Increasing access is huge, right? We know that. We're the worst. So what did it mean in the bill? Ty, you can help out with this one. And any other PTs if you know. Man, group 2 is just... Brandy's going to be tired. All right, Ty, tell us what this means.
The creation of the designation for this is that PTs will become primary care providers. That's the designation. That was the whole objective of the bill, or of the bill.
Why was that important to us? And just so you know, Ty was actually a part of this work group that helped figure out how this bill and why it actually mattered to Utah. We kind of put him on your team a little bit. He's on your team, right? Yeah, I mean, yeah.
There are many facets related to it. One, there's an underserved of primary care, as we've been talking about. Secondary, we're trying to take the pressure off of that. The next issue is that in order for a patient to go see a PT, a lot of the designation by the commercial payers is that there's specialty care. So if a patient has a total hip, and for those that are in the total hip world of the MDs, you're going to be seeing physical therapy for, let's say, more than 10 times. Well, if there's a specialty designation of a copay of $75 at 10 times, it starts to add up. What happens to patient care? What happens to the outcome? So these are a lot of factors that were taken into place as we looked at this designation.
So now that this designation, the specialty designation, was removed from physical therapy, that we will reduce copays for our patients. Because if you're a provider that refers to PT, that is most likely one of the highest level reasons for someone not coming to physical therapy. They have to pay $75 for a copay every single visit. With a specialty, they might just go once, but PT, they're going to be repetitive, and it can get really expensive for your fixed income people. So this allows us to have a leverage on reducing copays for patients, so access for them and decreasing costs was a huge reason for this bill.
Does that mean Medicare patients also no longer need a referral to it?
I'll get to that.
Oh,
Yeah, I mean, your team better be able to answer that. Okay. We're going to do 2 more questions, and then I'll just go through this. Can PTs sign the Physician's Disability section on the Form TC 842 for disability placards? Go. No one else is doing the exercise, but it's Brandy. All right, team 2. What do you got? Yes. Yeah, so this actually was not part of the bill. This actually happened a few years ago. Why are PTs a part of this? Why should they be able to define function for our patients? All right, we're not going to go there. You get the idea. All right, PTs, can we order imaging for patients? Yep. I think it's very clear, right? Yes, absolutely. This was not a part of the bill either. This happened back in 2018, right? What's unique about this portion, though? What should PTs do if they get imaging that is appropriate for someone else to see? Why? Scott, tell us.
We don't diagnose in respect, so if I want a job to take a look at a really gnarly herniated disc, I see on an MRI, then yeah, that's my job for that.
PT should only be ordering imaging with the intention to collaborate. That is a part of this bill. We need to be engaged with collaboration and have a physician or someone that's helping us out with whatever that entails. If it's out of our scope or if it's something out of our wheelhouse, we need to engage other people. Okay, so I'm just going to go through these last minutes. This one was back to Brandy's questions. Physicians have to sign PT's plan of care and progress notes for patients with Medicare insurance for payment. Does anyone know? Raise your hands. Everyone's like, maybe, yeah. So, in January 1st, 2025 this year, when a patient is referred to physical therapy from a physician or other qualified non-physician practitioner, this is a new exemption which allows a signed and dated order. So pretty much your order is what we need to be able to proceed. And then the PT has to actually complete the evaluation and send it to you. That's it. So my news to you, you don't have to sign all the paperwork to send back to us. We might have the line at the bottom of the page. It might be a policy of the therapy clinic, but you don't have to sign it based under Medicare rules. So you're welcome. No more signing paperwork. But we need to get it. We need to submit it to you for review, and if you need to change anything, you send it back to us within 30 days. This is just information. What's the average range salary for DPTs in Utah? These are your salaries. You can see average $81,000 for a doctor of physical therapy. Anyone see any issues with that? Just a comparison, your doctors of NP, their salary is at 106 average. You can see the different percentiles there. And then how much the DPT costs for program. And that's somewhere between $77,000 and $140,000 compared to a DNP, it's $30,000 to $75,000. You can see there's huge variations, right? A big portion of this bill is to get PTs paid better. I'm on the board of directors. My job is to get is overpayment, to improve payment for PTs. They're a high-level degree paid extremely low, and we need to change that. So all that said, we're going to skip this video for time's sake. But a lot of it comes down to we are the first point of contact. We evaluate, we diagnose, we treat. We need to screen for red flags and then refer to other people when appropriate. PTs are not very good at referring out. They should be one of the top referral sources out in the community. We see people as an entry point. Dr. Edwards, Brandy, they should be getting more referrals from PTs than other providers. We need to do a better job at this. We're preventing disease, promoting health, guiding patients, and helping making lifestyle changes, right? But we can do this in any setting, clinics, homes, ERs, schools, work sites, right? So I'm going to skip some of this because I have a guest here. This talks about different roles of primary care PTs. So Amber Ivy, she was actually my physical therapist when I was 17 years old, shattered my leg. Almost had it amputated, and she taught me how to walk again. She's the reason I'm in this profession. And she now works in a primary care role with surgeons, some of the top surgeons in the nation up at the University of Utah, and they round on patients together. And I wanted her to talk about her role and how one of the ways we can use physical therapists in these roles. So Amber, why don't you stand up? Why don't you tell us a little bit about your role and how it works in the University of Utah system?
Yeah, so I first started at the inpatient role, so I worked in like the orthotrauma section at the U, and then they started before COVID, starting to think about, because the University of Utah is very much into education and providing, and we have such a wide range of patients that we see from all over the country. The University of Utah sees 10% of the country. Which doesn't seem like a lot, but it is quite a bit. Nevada and all those kind of places. So they started implementing, we have them in the emergency room, we have them, I actually remember now we have them in the hemophilia clinic, we have them I'm in spine, we have 3 in total joints, we have all in our ortho department. Pain management, we have them in, as well as also neurospine, we also have them in as well. And we all have different roles that we're doing. We're already starting to implement them in our post-COVID. With our post-COVID, we have an OT that also does, he works with nerve palsies in the face that he does stuff with, as well as making your own 3D splints. He does a lot of that for our wheelchair bound and our neuro department as well. So what we have found, and I've talked to a lot of our physicians and our PAs, is like, what kind of things do we provide for you guys? One, like, for example, like, we have a program called our MedBridge program, which does our exercise program. So we have people that communicate through us that have simple questions that not necessarily need to go to our physician. So we provide a little bit of extra, take some of the work off you guys as physicians. So like, when I head back up to work, I'm working with the spine doctors. So if we have someone who needs education on what to expect in surgery, I provide that education. We might have someone who has stenosis, or we have a disc issue where like, hey, we need to have surgery in a few days, and let's just have you do the evaluation so that we know that they're gonna need the surgery, so that you don't have to try to get them into physical therapy right then and get it approved. And so it kind of takes some of that extra work off of our physician and our PA's table as well. So that's kind of what my role is. We have a huge program with our total joint setup where we follow our some patients I'm still talking to 6 months after post-op. I had one who's had increased in hip bursitis, so she sent me a message, so I sent her exercises that way. But I can also, if I'm going through notes and stuff, I can send messages to the nurses and say, hey, your patient was in the emergency room this weekend over this, and then that way it catches it for them, because we have 50 to 60 surgeries of total joints in a week. So.
How do you work with PTs in the community to improve access to care?
Same. Like, I know a lot of different insurances that a lot of the PTs take, and so I can go in and talk to them, and tell them, say, hey, where do you live? Because a lot of them are like, I think I have to go here, and you're like, you don't have to go to the University of Utah. And then I can explain, or if they live right around here, I can explain to them, or I can help them find one closer to home. Like, I'll have someone in Fillmore, they're like, can't come up to the U. I'm like, you don't have to come to the U. Go there. But then it's nice because if they want, they can also collaborate with me as far as that goes, because they can ask questions, because sometimes we send very simple referrals sources to them, and then they can always message me if they have questions about it. So.
How do you build the bridge between PTs and surgeons?
I'm kind of that bridge. So like if a PT contacts me, then I can like really quickly talk to the physician really quick, or if I already know because I've worked with them long enough, I can tell them what the answer is and then relay it really quickly to them, whereas the U is up to 3 days of getting back to them as far as that goes, because it goes through this long lane of commands and stuff. But I work with the physician, so like I had a patient had a question, so I was like, hey, let me ask her tomorrow. Let me ask him tomorrow, and I'll get back to you. And she was really cool with that, so I could just talk to him while he was in the office. So.
Amber knows probably more physical therapists and chiropractors in the community than any other person I've met. She knows everything about them. She has their personal cell phone number. Like if she has a patient that's seeing a therapist at my South Jordan clinic, she will literally text that PT at my clinic and say, give me the update on this patient. I'm seeing him this morning, what's the update? And she'll text them back, and she'll be able to relay it to the surgical team immediately that morning.
And it's been nice because I get more updates, and that's what I can tell patients is I get better updates from the outside PTs than I do from my own PTs that work at the U. So they can tell me if they're struggling, they'll let me know, they'll send me a message, hey, this patient's really struggling with this, and then I can we got a patient who didn't have enough extension, and so we were able to get on board and ordered that knee extension machine for them before they came in for their 6-week follow-up.
What questions do you have for Amber on her role and how she works together with surgeons and NPs and PAs and PTs and chiros? Any questions? Okay, I hope you can see the value of this bill. I mean, this kind of talks about the percentage of orthopedic injuries that get better with PT. You can see what percentage. These are some different randomized controls trials that I pulled, but 80% of rotator cuff injuries, 60 to 80%. Why would PT be important? If we can solve things without any additional invasive procedures, why not? If we work together as a team in these conservative approaches, these are just like post-op, how we can speed things up, knee OA. Just overall, research suggests more than 75% of orthopedic patients can experience a meaningful change with physical therapy, right? Can we solve this issue before it becomes something surgical or medicine related? Maybe. Overall, we want to expand our scope of impact. This is not scope of practice, scope of impact. We want to help out with these other things. There's too many things for everyone to serve. We all have to work together in creating change. So overall, what it takes to be primary care PT, we need to make good clinical decisions under pressure, right? There's just so many things that we have to sort out. We have to have good communication, collaboration. We have to prioritize things. We have to know when to refer out, when not to. We have to know, have strong intentions, tell people what they need to hear, right? This is the next level. And overall be confident. And I think this is a study from Chad Cook, but if you're confident in your practice, you're actually 35% better outcomes. And I think that's for all of us, right? We can be confident, but also give people options. So these are just a few advice from leaders, but we'll wrap up with this. This is just a quote from this is biased because it's the APTA president nationally, but PT is the best kept secret in healthcare. I think people don't know what PT can do for them, and I think it's important to remember how physical therapy can really help people. So thank you for being a part of this revolution. Every single one of you really matters. And if we all collectively work together, the outcomes of the patients can drastically improve. We can literally create the healthcare system we want. It all starts with us. So thank you for being a part of that.